It doesn't take very long for the wax or the compound to be sufficiently soft to then apply the tray to the bow. All that is necessary is the tray is clipped into the face bow and making sure that the tray is completely seated in the bow. The patient then grabs the tray and we guide it into the mouth. The only key step here is to let the little vertical component on the tray bump the central incisal edge, and then the face bow is positioned in the patient's face, and then the vertical rod is centered right over the glabella. With the patient sitting erect, the horizontal plane can be verified by both the vertical rod and the Bio-Esthetic level. In the sagittal plane, the face bow can be also checked by rotating the bubble level to the side and ensuring that the vertical rod is also perpendicular to the bow. Notice we have the rod positioned perfectly vertical in the patient's face. In addition, not only is it vertical, it's positioned precisely along the facial midline, not the dental midline. Notice also the bubble is perfectly positioned in the center. Notice from the frontal plane, the patient's position in the chair is not as critical. However, from the sagittal plane, it's important that the patient is sitting as erect as possible in the chair, because arbitrarily tipping the head too far back or too far forward would make an error in the positioning of the bow. In doing it this way, what will happen is you would ensure that the occlusal plane is transferred to the articulator more accurately the way it looks in the patient's face. It's removed. It's so much easier because we don't have anything in the patient's ears. It's much less cumbersome. Patient acceptance is much easier. And as you see, there are no screws required to position this bow, and so there are no additional tools necessary for this procedure.